CEO and co-founder. Want to welcome Governor Dan McKee to GoLocal Live. Governor, thanks so much for joining us.
Well, my pleasure, Josh. Thanks for having me.
So it's a little bit of a busy day. Let's jump into it. Lots to cover. Dr. Nicole Alexander-Scott is departing. She's been the health director for the better part of the last 7 years, and she's overseen certainly aspects of the response during the virus. Your thoughts on her departure?
Yeah, as I mentioned in the release we had, it's, she played a critical role in the efforts to keep Rhode Island safe. So we're very, appreciative of that work. This is something that we've known is going to be happening internally for a little while. We've had meetings with the doctor, which said that she felt as though she had a window of opportunity that she was there facing. So we're coordinating a strategy to transition in a way that is going to be good for the state of Rhode Island and good for the Dr. Alexander-Scott.
Yeah, lots of rumors swirling on where she's going, but let's talk about the state's response. We've had some low lows. We're back #1 most infected. We've had that position a number of times. I mean, to some degree, the numbers speak for themselves. This happened under Governor Raimondo. It's happened under you. Why can't we beat this thing down better than we are?
Yeah, so I push back a little bit on that. I mean, that's where we were since the beginning of the pandemic, Josh, right?
Yep.
In terms of the fact there. If you look at the same reports, the Johns Hopkins reports, the New York Times as of today, it's not where we were in the fall, where we were like one of the lowest infected states in the country. In fact, we were probably in the bottom 5 for several months. Today we're like 31st most infected state in the country. So that means that we're better than the middle, which I don't like. But again, I want to make sure that people understand that data points, from my understanding, is right from the beginning of the pandemic. It doesn't really measure where we are today. And I think you need to look at both to fully understand where we are. I mean, last week, 175,000 tests were given in the state of Rhode Island, more than any other state by at least 4 times what Massachusetts done. So we want to make sure that we get through this pandemic. Obviously, currently there has been a high infection rate, and we want to make sure that people protect themselves, as I am as well, and making sure they get boosted. And then if what we're hearing from the Department of Health comes true, which we pray it does, is that there's going to be a de-escalation of that infection rate, in a just short period of time. So time to be safe out there. We're working our way through it. On the top of the question, Dr. Alexander-Scott, with the whole of government team, has been at it in a way that I think that Rhode Islanders can feel very, very proud that they've responded. I think that right now, I think we're neck and neck with Vermont as being the most vaccinated state in the country. And that's something that yet at the same point time, I just want to make sure that we understand that's information from the beginning of the pandemic. It doesn't measure where we are today or where we've been in the last 6 or 7 months.
Let me just push back a little bit. The New York Times has us on the 14-day rolling average as #1 in the country for most infected over the last 14 days. They have us at about 500 cases per 100,000. New York's #2 in the country and significantly behind. You are right in that New York and New Jersey both seem to have topped out in the Omicron case level and seem to be dipping down. But if you look at South Africa, which went from about, on November 7th, 250 COVID cases in the whole country, to a month later having 37,000, they've gone way down, but they're still running at 7,000. This is a tough variant. Not as deadly as Delta, but it seems to hang around for a long time and obviously is wildly contagious.
Yeah, and we have, and I can tell again with the leadership that's coming from the DOH, a National Guard. We're trying to help with the staffing right now. We had a great announcement yesterday about FEMA coming in to help both Rhode Island Hospital and with staffing, as well as down in Kent County. But remember that the numbers of infections is a direct relation to the number of tests. We're doubling the test of any state in the country right now. 4 times as much testing going on in Rhode Island right now than Massachusetts. So yes, our numbers are up. That's good. It's good that we're identifying that, because we want to, identify as many of the cases as we can. But if we were testing at, 25% of what we are right now, that number would be significantly different.
Let's jump over to vaccinations. You make a good point. Rhode Island's second only to Vermont in the total number of jabs out there. But on the boosting, which is so critical now to be able to keep people out of the hospital and from dying, how do we spark people to make sure that they are out and getting boosted?
Yeah, that's an area that I really do think that we need to focus on strongly. You and I definitely agree on that, Josh. This is very important. Where when I got my booster shot, back in October, it was more of a like, well, I'll go get it because it makes sense. But right now, it is so important that we do. It wasn't until about the week after Thanksgiving, right, that the CDC brought it down to people under 65 years old. And now we had a 12 to 15 I think in the last week or 10 days, or very recently. We need to double down on this. Really, what we need to see is the response that we got during the time frame when I was saying that we were going to get 90% of our population, adult population, vaccinated. And we need to go back to that spot. So the more we can reinforce with people that the boosters are so important. Many people have decided not to get vaccinated. I don't understand it. I'll respect it. We need to also tell the people who aren't vaccinated right now that they need to be extremely careful while this new variant is around, because they represent about 10% of the population, adult population in the state, Josh. They're representing 50 to 75% of the people in the hospital at any given moment in time in on COVID. So
yeah, I think you should encourage them to go to Massachusetts hospitals and get out of the Rhode Island hospitals if you're not getting vaccinated.
It is frustrating. We can keep on asking, but I think the best way to, at this point is let's get people boosted at the same levels that, I'm looking to get. I've set out about 2 weeks ago, 90% of the 90% that are fully vaccinated. Let's get them boosted. What's going to give us a bump right now? I got to give a shout out to the universities and the colleges. The way that they came in and they required fully vaccinated to get on campus in September. They're now requiring fully, boosted to get back on campus now in a couple weeks, when they resume their classes, on the college level. That's going to bump us 4 or 5, 6 points just on that alone. But hopefully it starts a trend where we are getting boosted, just like you said. I'm totally on board with that. I think that we can do better at it, and we need to spend more time and invest more energy to make that happen.
Governor, let's switch subjects a little bit. We're going into the General Assembly session. There's some big bills pending that are getting some attention. One of them is the hospital merger legislation, and they seem to be running a high-level PR campaign. I don't mean to dismiss it out of hands, but it does seem a little top level, not very grassroots. It kind of reminds me of the Greenhouse Compact effort, which didn't go so well. But here's two hospital groups. You put them together, they are the most powerful business entity in the state of Rhode Island. Spare no one. They'll employ 3 times as many people as CVS does at its corporate headquarters. And you're merging two things, one that's financially seems to be stable and the other one that's not. How does this work? And we're seeing how frail they are during this period of time. They have literally thousands of job vacancies.
Yeah, so it's certainly a point in time, Josh, where the healthcare industry is stressed right now. You mentioned about the staffing. We need to make sure that we're doing everything we can, and we have some short and long-term strategies right now. I was on a call last night. We had 67 nurses graduate from Rhode Island College last night. We did it virtually. We're hoping that they all go into the workforce. We also got to incentivize that.
Did you send Ubers for them to drive them over to a job?
I went on and I was asking their parents, and I was asking them to stay in the state, and I was trying to give them every reason to do that. And I think we have a lot of good reasons right now with some of the things that have happened economically. But on the question in terms of competition, they need to really show that pricing is not going to change. They need to make sure that there's more than just a promise that they're going to keep stable pricing for a period of time. If there is a merger there, and there's reasons why you would, there's reasons why you won't, just like you said, but it's got to be in the best interest of the state of Rhode Island. I do have confidence in the Attorney General, Peter Nerona, in terms of his evaluation there. And then with the Department of Health changing leadership, that's clearly going to be some of the questions that I would ask an incoming director that is going to have, a strong input in terms of what happens in that situation. That's going to be part of the interview process. And by the way, we've already had 2 or 3 very good candidates, to take the position at DOH. That will start vetting that process very quickly, and I'm very confident that we'll have a very qualified person. We're so fortunate in the state of Rhode Island to have so many epidemiologists and right at our grasp that have shown national attention, and the people that are working with them. So I think that we'll have a good opportunity there, but it's got to be vetted. There's got to be a real strategy there. I was on a call today with one of our departments talking about how we're going to contain medical costs and health coverage, costs in the state. And that's front and center, Josh. Yep. They need to show how they can control and contain costs. Otherwise, I don't know how you could really support the merger.
Yeah, I mean, listen, I was in email exchange with Professor Gaynor. He's the leading expert on this in the country at Carnegie Mellon. He says, listen, I've looked at all these mergers. There's 2 things that come out of these mega mergers: higher prices and less quality. And he's testified before Congress. He was the feature in a New York Times story about a year and 2 months ago. The now Biden head of HHS used to be the Attorney General in California. He fought against these mergers endlessly and blocked them. He couldn't find how the patient, how the Rhode Islander, how the California resident benefited from these things.
Yeah, and that's why it's got to be vetted. It's a really good time to be doing it, quite frankly. As you're coming out of a pandemic, you're seeing the stress on the healthcare industry. You're seeing the importance of having care for everybody in the state of Rhode Island in a way that they can afford. So this is a real good moment in time. I think it's an appropriate timing, Josh, to have this conversation because you're going to bring in those factors, and on the heels of the pandemic, it's so apparent, where there may be some areas that some people can't afford the care. That this is all going to have to kind of roll into this overview, and in the end, whatever direction it takes, we want to end up with a better, more complete healthcare system that has that's competitive. I think there's ways to do it. We are funding a piece in our current budget that'll be in my overview about controlling and containing healthcare costs, and that's going to be part of this, this overview, so that I'm up to speed in terms of being able to take an intelligent position on it.
And Governor, last question for you. Unfortunately, every day we get notified of another small business closing. Obviously, the restaurant industry is getting hit particularly hard. All these diners and small family-owned restaurants that we all love. That's what makes Rhode Island, Rhode Island. They're the place you go and meet in the morning for coffee. How do we save them? I mean, no business can take on 2 years of this, and it seems like, CVS is doing fine and Hasbro's doing fine and the major corporations. How do we make sure we protect as many of these small businesses as we possibly can?
Yeah, so not only being a leader in the vaccinations, being a leader in the testing has also brought us to this point where we did have music in Newport this summer. We did have a water fire, and what a great first water fire, if anybody didn't see that, honoring the first responders in the state of Rhode Island. And one of the first things I did as governor, coming out of lieutenant governor, really focusing on how to use the federal dollars to help protect as many small businesses as we can. We identified $30 million that was not was appropriated but not allocated, and we were able to get 5,000 grants out to small businesses. We've been fortunate now that the General Assembly acted on our down payment of about $120 million, $119 million first day of session. Part of that is in the small business community. Some of it's in childcare, which many of our small businesses are in childcare, along with housing. So I think you got to keep on being very smart about the investments that you make, with the dollars that you have. And then you've got to identify, like you said, businesses that are really worth investing in, and the people really believe in it. As a small business owner myself, we're very persistent. And then you got to create some strategies. I think that you'll see in our next ask, not only in our budget, where we're putting a small business friendly article in the budget, Josh, which again is a first in terms of an intentional strategy to create small business friendliness in the state. And you're going to see in our ask relative to the balance of the APRA funds of that 1.1 billion, you're going to see a portion or a reasonable portion in there to help our small businesses in the hospitality, in a number of the areas, and geographically where they get hurt the most. So you just got to keep your eye on it. I've staffed up for this. We have a specialist that we've hired into Commerce just doing small business issues, as well as in our office. So I think that the General Assembly, I think that the general public at large understands, especially after coming out of this pandemic, how important our small businesses are to our community, not only in terms of the quality of life they provide, but also the fact that they have jobs, and local communities, like you said, they rely on, they like the culture of their small business community. That's part of the character of any one of our 39 cities and towns.
Yeah, I really, first, let me thank you for joining us today. What should Rhode Islanders be looking for over the next week from the McKee administration?
Yeah, so I think front and center is going to be the health and safety of the people in the state of Rhode Island. We're going to continue to show that on the booster issue. We're going to continue to work with all our partners in the municipalities, make sure that there's testing and that the shots are out there. So that's top priority. But we're also going to see a State of the State address that's coming up on the 18th, which we're going to outline a vision for the state of Rhode Island, the Rhode Island 2030 plan, Josh. I'd ask your listeners to go to ri2030.com. It's an extensive draft document that's with hundreds of hours working with people throughout the state of Rhode Island about what could Rhode Island look like in 2030 if we invested in our economy, in our blue economy, our green economy, in our housing or our health care or our education. And so that's going to be a blueprint that I'm going to work on, as long as I'm governor, of the Rhode Island, which has been an intense experience, but it's one that I'm embracing.
Governor Dan McKee, thank you so much for joining us on Go Local Live. For everybody else, stay tuned for much more. We'll have a roundup on this and everything today. Stay tuned. If you haven't gotten boosted, run, don't walk. Get boosted as soon as you can. It's the best way to stay out of the hospital. Thank you.
Yeah.